The elbow is made up of 3 bones and 3 joints. We tend to think of the elbow as primarily flexing and extending, but it also has supination or turning upward this way and pronation or turning down. So there's a lot of complex anatomy in the arm, in the elbow region. Generally speaking, most people who are coming in with elbow problems are going to be complaining of either pain on the extensor side of the elbow or on the medial side of the elbow. We'll get into a little more detail with that with specific videos. To map the elbow, if someone comes in and says, I have pain in this area, we'll primarily be mapping just that area. There's really no need to go somewhere else. Whereas if they're complaining of pain on the medial side, on the inside here, then we'll be mapping that area. So let's say someone comes in and they have lateral elbow pain. We're going to take our conducting gel. We're going to run it up and down a little above the joint with the humerus and below. And then we're going to slowly map in a proximal to distal direction. So that means high to low, coming down, back and forth, looking for feedback or listening for feedback from the patient, or picking up a facial expression or grimace, which just tells us a little bit of an apprehension sign. So along with our examination and our history, and if we have any diagnostic ultrasound or MRI, the soft tissue, and it shows there's a problem in the area, we know where to go, and the mapping will help us to localize it. If the patient had a problem on the medial side, I would flip the arm over here, or just start in this area, and we would be going back and forth on the medial side as well. And also on this side, the medial side, we will come across the arm a little bit for the pronator teres, which we'll get into in a little more detail. But mapping back and forth or up and down, gently moving around the arm. Lateral elbow, same idea on the lateral side. We can always use the olecranon as an anatomical mark to move around. And again, we're listening for the patient to tell us where they feel it the most. Also, we can check their face. If they grimace or wince a little bit, we know that we're getting what's called an apprehension sign, hurting them in that area, even if they aren't telling us that.